D1 flexion, we're going to start in extension, all right? So D1 flexion is flexion, adduction, external rotation. So how do I have to start?
Abduction, external.
Internal.
Oh, internal like that.
So we're going external, okay? So, and I can tell you that it's plantar flexion at the ankle. Okay? So now she's going to go from here, extension, abduction, internal rotation, right? And she's going to go into flexion, external rotation, and adduction. So she's going here, and dorsiflexion, okay? So she's going from here, sorry, because I forgot to move my hand. She's going from here to here, all right? And then she's going from here to here, toes down, okay? So that she's internally rotated, abducted, and extended. But she's going into flexion, hamstrings, dorsiflexors. Bring your foot back towards you, bend your knee, bring your leg up. That's it. All right? And now flip my hand, and now I want you to push down and out. That's it. Bring your foot down, push it down. Okay? Up and in. Don't fight me, just do what I'm telling you to do. And down and out. Now, you see, even though she's a small person, when I got here, what did I do? Did you notice? Did anyone notice what I did when I was here? I leaned her knee against me so that I can move my hands without dropping her leg. All right, because coming down, point your toes down, that's it. Coming down, I'm not under that part of the leg, am I? So if there's gravity, relax, Nicole, relax, relax. If there's gravity, I don't really have a lot to hold on to, except here. So for me to turn, I just kind of lean them against me, and then I went down. You can use whatever body part you need. And up, toes back, that's it. And now toes pointing down and kick out. That's it. Okay, so facilitating extensors, plantar flexors are extensors, and flexors coming up. Okay? All right? So that's D1. David, read D2. Lower extremity D2. What's the flexion pattern? D2, no, she can read it. Okay, here it is. So just tell me the D2 pen, don't worry about the pelvis. Just tell me this part. This part. So D2,
Flexion,
she's going into
flexion,
flexion,
abduction,
abduction, we just went to AD,
internal rotation.
and internal rotation. We just did like the opposite, right? So if she's going into flexion, abduction, and internal rotation, she's going to end up here. So where are we starting? Don't read it. Don't read it.
Extension.
Somebody tell me.
Adduction.
Extension,
Adduction.
adduction, and
External.
external rotation, and plantar flexion, because you're always going into flexion, you're going into dorsiflexion. So now she's going from here, this position, okay, into this position. Internal rotation, abducted and dorsiflexed, and flexed at the hip. And now she's going into this. Okay? And now she's coming into, put your foot back. So it's awkward, it's like an awkward position, and it's more awkward to handle. So it's simple in the execution as far as you know where you're going, so you know where you have to start. But this one's a little bit harder with managing because, as I said, the leg is a much bigger extremity. And she's little. If I do one of these guys, you know, have a bigger leg, a heavier leg, it takes a little more. But again, I haven't changed my positioning. I'm still in the diagonal, whether I'm here, going here, or I'm here, going here. I'm still in the diagonal.
What they call a deduction here, not crossed.
This is a deduction,
Yep,
all right? If you want to bring it all the way across, that's fine.
okay.
This is still a deduction. I have to cross the midline to be a deducted, correct?
Mhm.
This is neutral. This is a deducted.
Okay.
So just remember the flexion pattern. If you remember what the flexion pattern is, you'll know where to start. And then you'll automatically know the extension pattern. So if the flexion pattern of D1 is hip flexion, hip A deduction, and hip internal rotation, then I'll know which way I have to start, correct? So if you're going to memorize anything, just memorize what is the end position for the D1, D2 flexion upper, D1, D2 flexion lower. And from there you can take it any way you want, because you'll remember you have to start in the opposite position, right? So it sort of becomes easy. It's doing it that is difficult.
Coordination.
Doing it, yes. A lot of times, David, let's go on the mat, the big mat. Oh, yeah, yeah. I'll be here. It's okay. I want you to lay on the mat.
On the side here?
On your back, anyway. When I have when I'm working with a patient and I'm doing Pnf, a lot of times I am not standing. I'm not standing. I'm on the mat with them. So just say I'm going to do, I'll start with an upper. I'm going to do an upper extremity pattern, right? So say I'm doing D2 here. Actually, I'm going to do it this way. I'll do like this. I'm here, right? If I want to do D1, I may be here. Okay? If I want to do the leg, so I'm going to start with abduction, internal rotation, extension, abduction, internal rotation. And I'm going into flexion, external rotation, and a deduction. I need to be a little closer. So I may do like this. But you see, I'm on the mat with him. Just so you know, it's not always going to be that situation. It's almost never going to be that situation. Because very few clinics have those single mats. And when they do, they really kind of use them for giving someone electric stim or ultrasound, because then you're right there with them. Because you remember in the clinics, your patients, if you're talking especially adult patients, because we do more NDT with kids than Pnf. Okay, we do some Pnf with them, but more NDT. So with the older population, you're going to have much bigger people, because the whole population is heavier now. People are more overweight than underweight or normal weight. And also they have lots of other problems going on, you know, with them. So they're going to be more difficult to manage. They may have a lot of tone and or extraneous movements or things like that. Mostly it's tone, it's usually spasticity. So you may not be able to, you know, stand very nice in your little in motion and do it very nicely like we do on each other. So you sort of have to adapt for that, okay? And so you may want to, when you're practicing over the next couple of days, practice on a mat like this and see what it feels like to be sitting like this on a mat with a patient. I mean, this is my preferred mode of treatment, right here. Because I can jump around and I don't have to worry about my patient. If I have a patient on a table like that, and I want to walk around to the other side, I have to make sure that I have my hand or something on that patient the whole time, that they're not going to suddenly fall off, because how narrow it is, right? So it just, it'll be a good practice for you to also try doing it like on a mat like this, so that you can get that feel of the motion. All right? Okay, so now practice D1, D2, flexion, extension, lowers.